With the lymphatic system, it actually has a lab that correlates with it, so you actually have lymphatic organs that do the job of the lymphatic system. With the immune system, there's quite a bit of overlapping that occurs, but with the immune system, you only have blood cells that do their job, so there's no organ system and no lab to go along with the immune system. So with the lymphatic, you have several slides of histology and things on those slides to compare. The model of the tonsils, and you have the lymph nodes and the spleen that is seen on the model from the classroom. So first off, with the histology, you have a lymph node from your lab book on the right, and then another bigger picture from your lecture notes. If you recognize, you have adipose tissue on the surface, the connective tissue making up the capsule, but you have these circular areas which are called lymphatic nodules. So they're dispersed all through the histological slide on the left. On the right hand side, you can still see the circular areas. They're not as pronounced, and then the middle portion of those is known as the germinal center. So the middle portion of every lymphatic nodule has a germinal center, and the germinal center, if you remember from your lecture notes, houses T cells, B cells, and macrophages. So remember, your T lymphocytes, your B lymphocytes are going to be made in the thymus, or mature in the thymus, and then mature in the bone marrow respectively. T cells versus B cells. Then remember, your macrophages come from monocytes that have left the blood. They've gone out into the tissues to actually do the job of being a macrophage. So all of those are found in the germinal center of your lymph nodes. As far as the spleen, you have the figure on the left from your lecture and the lab book on your right. So if you notice, you have the central artery that's labeled. So the open area that's there is the central artery. And then from the lecture notes, you have the area where you can see white in the background. On your lab book, you see the dark purple and then the white areas that are much more pronounced. So that's your white pulp, this whole area around the central artery, where on the left hand figure you can see the white pulp very distinctly because the purple area stains and then the background has white dispersed in the background. Where the red pulp, remember, your erythrocytes, your red blood cells, go to the spleen to die off. Remember, it was the erythrocyte graveyard. So the red pulp is where the red blood cells are housed and where they're found. In the figure from your textbook, they have it labeled around the outer edge, so you see the little pink cells in the background, which are your red blood cells. As far as a tonsil, you have the lymphatic tonsil from your lab book, where you can see the tonsillar crypt. Again, you can see the lymphatic nodules and the germinal center that is there. You can see the crypts from a different dissection of the tonsil, where you have these open areas. Remember, this is where your white blood cells will reside. So with something like strep infections on your tonsils, you have the little white pus pockets that are there. That pus is in correlation to the white blood cells that are trapped with the bacteria in these tonsillar crypts. So CRYPTS, crypts. Of course, the pharyngeal epithelium making the outer layer of the tonsil, and then of course you have the lymphatic nodules that are labeled, the circular areas with their germinal center, where more white blood cells are usually found. As far as the model of the tonsils, of course, you can see very easily when you look in the back of the throat. For people that have not had a tonsillectomy, you can see the palatine tonsils. So you have the soft palate, you have the uvula, the little hangy down thing, and then on each side of the wall of the pharynx, the pharyngeal tonsil would be up in the pharynx, the upper part of the throat. The palatine tonsil is attached to the soft palate, so you can't see the pharyngeal tonsil, which is the adenoid, so it's up in the upper portion of the pharynx. So you can see it labeled as 1 from your lab model. So as the air is coming in, it's going to hit the back wall of the nasopharynx. There's where the adenoid is located. Then of course you can see the turn downward into the pharynx or the throat. So again, the uvula is seen here, your soft palate here, and then on the back wall, number 2, would be your palatine tonsil. On the root of the tongue, you have your lingual tonsil that is there. So the major way to see that is with a laryngeoscope. So a lot of times when you begin to intubate someone, if you happen to do that in your career, your field respiratory therapist are licensed in some states to use the laryngeoscope and to intubate. So there's the epiglottis, the flap that's over the trachea. Right above that, you have number 3, which is the lingual tonsil. As far as your lymph nodes from the model, if you know again regions of the body, you should be able to pick out the different lymph nodes in that area of the body. So of course, going up the back of the head and in the back portion of the neck, that's your cervical vertebrae that are in this area. So number 1 would be your cervical lymph nodes. Underneath your arm, number 4, you can see the axillary lymph nodes. And of course, with breast cancer, they're very closely associated with the breast tissue. So these lymph nodes a lot of times are removed if a malignant biopsy comes back from one of the breasts. So this is your axillary or armpit lymph nodes. Then you have the right lymphatic duct. Remember, that's the duct that is coming into the subclavian, the right subclavian artery. It's coming from the right arm, the right axillary region, and the right thorax. Then you have the bronchio lymph nodes, which of course, there's your windpipe or your trachea. The esophagus is behind it. So that first branch is the primary bronchi and secondary bronchi that branch out into the lungs and the pleural cavity. So that's at number 5. Then you have the thoracic duct. Remember, it comes in the left subclavian into the superior vena cava. So it drains the left side of the head, the left arm, the left thorax, and everything from the lower portion of the diaphragm and the lower extremities. And then you have the submandibular, number 6, underneath the mandible, you have the submandibular lymph nodes. So of course those are usually the ones with the cervical that swell if you have a sore throat or a sinus infection. So remember where your jugular vein is, your internal jugular coming deep within the neck. You have your cervical lymph nodes that wrap around it. In the armpit, again, the axillary, and all of those empty in from the right lymphatic duct into the right subclavian. Your thoracic duct, again, coming up from the lower extremities through the midline of the body there within the thoracic cavity. So on this view, you can see the cisterna chyli, very much so, the little open area, larger portion of the duct. Here it's number 7, so that is the cisterna chyli. So all of the fluid from the lower extremities are going to empty into the thoracic duct using the cisterna chyli. You also have the right lumbar and left lumbar trunks. So those, of course, go into the regions of your lumbar portion of the spine. You have your gastric ducts that go, or the gastric lymph nodes that go into the stomach, so they feed onto the surface of the stomach. And then you have the intestinal lymph nodes, also known as mesenteric, so they're feeding into the intestines, but they also feed in with the blood vessels that line your mesentery. So these are the connective tissues that hold your, especially your small intestines in place, but your large intestine, they're called the mesentery. So they have lymph nodes that are associated with it. And you have the inguinal lymph node. So remember the inguinal region where the trunk of the body starts to go into your thigh. The lingual or inguinal lymph nodes there from the lower extremities. Then recognizing your spleen, of course, from the model it's labeled here, but with the stomach removed, you can see the pancreas directly in the upper left quadrant, usually, unless the person has situs inversus, you have the spleen. You can see the spleen in this area with the stomach in place, with the transverse colon still in place. and the small intestines there. So the spleen from the lab manual, or you can actually see it with everything in place on the model.